do you agree with that a lot of the social disruption that's going on at this point is based on hysteria and overreaction that rather than a necessary public health intervention?
I think that there is a lot of fear and anxiety, and I think in the public, I think it's based on we're facing an unknown, and that as we learn more about this virus and can provide facts and evidence, we can calm that down. I think we go through phases. There's a lot of unknowns now. It's just now coming into the population. Frankly, I think we're going to get a bit more used to this. People are going to learn about it. And I think it will level out some.
But, maybe one of the reasons for the hysteria is that it's more contagious than something like Ebola. Like previous health scares were even less of a threat. This is actually more widespread. It's invidious. It's insidious. You can't see it, and it's spreading.
Right.
So that's another additional fear factor.
Yeah, it's new. I don't know. The psychology is interesting, but I think it's new. The flu is here all the time. This is something new and different. It's coming from a bat or an animal into humans and spreading around the world.
Of course, but influenza A came from birds into humans, right?
Of course.
So, I know. And then you put up the figures when you're on TV. You put up the figures and you see 11 deaths, and then they show the flu, 25,000. Or 35 million cases versus 100. Well, it's probably 5,000 cases, 10,000, but it's a dramatic difference. Mark, final thoughts?
Yeah, just a couple things. I do think that things have shifted a bit in the last week, that we're probably entering a phase now more of not containment or limiting it, but more mitigation, trying to reduce the damage as much as we can, and particularly for those at highest risk, those with chronic conditions and the elderly, the frail elderly, avoiding unnecessary exposures. Just as Paul has really made a great point, just like we should be doing anyway for flu. I also feel very much that we still have to have some humility, that we don't know everything about this, and we have been thrown curves in the past. Who thought Zika would be a viral cause of birth defects? So it could happen. Something unexpected might happen, but so we have to be a little bit humble still, I think.